welcome back to our Konti Cancer, a journey of hope and heal. So happy New Year to you guys, and happy New Year to my new co-host. Okay, why not you introduce yourself? No mind.
So I'm using Hanim signature. Hi, hi, hi. If you guys remember, I was in the third episode of Konti Cancer MAKNA. I introduce myself again. My name is Ahmad Nukman. I'm the Assistant Program Manager in MAKNA. So Hanim, today we have a very special topic. We have a very special guest as well.
Exactly, far away from Malaysia.
Yeah.
Different time zone, but she can make it to our time. Thank you.
So we would like to welcome Alexandra Lagardia, Campaign Manager of Union for International Cancer Control, UICC. Welcome, Alexandra.
Thank you so much. Very happy to be here.
Okay, Alexandra, maybe you can introduce yourself.
Sure. So I've been working at the Union for International Cancer Control for about 4 years. It's an organization based in Geneva, Switzerland. And my role focuses on the World Cancer Day campaign, which is one of the largest global health awareness days that takes place every year on the 4th of February.
And of course, we would like to know more about you. But my question is, how did you first get involved with the UICC? How when it started?
Well, I didn't start in health. I started through the communications route. So my education was in literature, culture, communications. And I started in Geneva at the UN Department for Global Communications. And then a position opened up at UICC in the communications team. So that's how I came in. But then the whole world of global health and cancer control opened up to me. And I really enjoyed also the topic. So now I'm actually also doing a master's on the side in global health policy at the London School of Hygiene and Tropical Medicine, so that hopefully I can combine those two interests, communications and global health.
I see. All the best. It's not an easy journey.
So basically, giving back to the community, right? Yeah. So we talk about World Cancer Day. It's such a massive global moment, massive global movement, and the question is, why did the UICC choose February 4th as the anchor date, and how has the significance of this day evolved over the time?
Yeah. So there was a big summit in Paris, and during that summit there was a charter against cancer, and that was signed on the 4th of February, and therefore.
So maybe we can start about the campaign, right? Yeah. Okay, so for the past 3 years, we realized the team was closing the care gap, and then new team like United by Unique. So is it this United by Unique built upon our previous work? Is it continuation, or is it a totally different concept?
That's a really good question. So the campaign runs in 3-year cycles, because we thought that with these big themes, it makes more sense to have time over 3 years to really understand and take action, as opposed to changing it every single year. So as you said before, it was Close the Care Gap, and that was about reducing inequities in cancer control. And this year we've moved on to United by Unique, which is about people-centered care. And there is a continuation, because both are very linked. One of the core principles of people-centered care is reducing inequities, as well as many other things. So a lot of the themes that we were working on in previous years come back again and again in this new campaign period.
I understand.
And how your team came up with each of the campaign. I know it's not an easy work to do a campaign, right? So how your team strategize all this? Is it like a one-man show, or is it a variety of people and backgrounds coming in?
Yeah, that's exactly. So it's not me that chooses the theme for the world. It's a long process of stakeholder mapping, talking to our global membership. So UICC is a membership organization of over 1,000 members around the world. That includes NGOs, CSOs, hospitals. So really talking to representatives from different regions on calls with them and asking them, what is a big challenge that you see? What is a topic that you want to hear about for 3 years that you think deserves more awareness, more attention, and eventually change? And people-centered care was therefore the topic that UICC's community, the cancer community, chose. And then what we do is just try and package it into a kind of comprehensive, narrative, but always trying to keep it broad and transferable so that different countries or local organizations or regional bodies can then adapt it to suit their needs. There's no one size fits all when it comes to, to cancer control, health systems, or to people-centered care.
Yeah, and we was informed that this campaign was actually on the second year because it started last year, right? So is there any, to flashback about last year, is there any memorable events or program that was held last year?
Yeah. Yeah, there were 900 activities held
around the world. Wow.
Yeah, in 102 countries. So lots and lots to choose from. I would say one that stood out to me quite a bit was one in Portugal by the Portuguese Cancer League, where they had a gathering of people in one of the squares, and they created a human chain where they basically created a chain with hands, and then in the middle of these chains, they put people living with cancer. So it was a kind of visual representation of putting the person at the center of care. And I just thought it was really, really nice. We were in Geneva, but they sent us a lot of pictures and videos, and we loved that.
Very interesting activity. Yeah. Maybe we can implement in Malaysia as well.
We can do it actually.
For World Cancer Day?
For previous year, we do have few activities. One of it is like we do parade. We walk. We have KL car free, so few volunteers and cancer survivors. So we walk together. It's part of the getting along together and sharing to each other. And the focus is not only the cancer patient, also with the caretaker as well. That's one of the activity. But basically, we in MAKNA, every day is like World Cancer Day for us. Like every day we have many activities, like really focus both team, like closing the gap, and also united by
unique. Yeah.
Because as you know, Malaysia have different culture, right? So this our AIDS, we didn't differentiate whether you are different race or whatever. We still we will have everyone, despite the race, despite
different age, different races, different skin color or political view. We treat people equally in here. And talking about all these differences, one thing came into my mind. When you talk about a campaign globally, when you focus on a lot of countries with different different background, different educational level, understanding level, different races. How UICC see this actually?
How do we make the campaign kind of resonate at a global level? Is that what you mean?
Yeah. And how does it suits to a local level?
Yeah, understood. Okay. So I think we always choose a theme that can be adapted based on context, culture, country. So we would never choose a theme that's kind of, I don't know, lung cancer for 3 years. It would always be something broader, but that can still suit specific the work of specific organizations. So with people-centered care, the principles are universal, but then different organizations can adapt them to their own needs. So, to give a quick example, one element of people-centered care. Sorry, I'm realizing I'm answering about people-centered care, but you had asked about the campaign.
Yeah.
Eventually, it's similar.
So we are going into that. Yeah.
Sure, because I could also talk about the campaign itself. Like how do we translate the materials and so on? Is that more what you were looking for?
It's up to you, because we're going to the people-centered care after this. Yeah.
Okay, fine.
Yeah.
Okay, so I'll just retake that question, but keeping it on people-centered care then.
Yeah.
So the campaign on people-centered care we chose because people-centered care has universal values that can be adapted to a local context, culture, or country, and every organization can use the theme to suit their own needs. So, for example, one of the core principles would be around equity, inclusion, and the engagement of people living with cancer, making sure services are tailored to respond to their needs, and making sure that they acknowledge barriers such as stigma, discrimination, language, gender, and so on. And to give one example of this kind of universal principle taken to a local context would be in New Zealand, where there's a government program that works with the Maori indigenous community there to tailor, to co-create lung cancer screening programs so that they can be adapted to those minority populations and make sure that everyone is included.
True, there's no discrimination in cancer, and also there's no discrimination in getting treatment.
Yeah, sure.
So basically, this United by Unique is more to human-centric, right? Like, for example, like a major part of United by Unique campaign is individual stories behind their diagnosis, isn't it? So what do you think? Like, what it is so important to shine the spotlight of the people? Like, for example, the patients, the caregivers, the committee. Yeah, or maybe you can share, is there any particular story that really resonate you for this campaign?
Sure. Yeah, I mean, as you said, the reason that we chose story sharing as a core element of the campaign is because it illustrates the theme of people-centered care. So as you read the stories one after one, you realize that every experience is unique, but there are also themes that unite between the different stories. And on our website, we gathered already over 600 stories, not only from people living with cancer, but also, as you said, from caregivers, family members, supporters, healthcare professionals. So really all of these different voices and perspectives coming together to talk about cancer, to raise awareness, to highlight the gaps that exist. And one of my favorite parts of my job is reading these stories as they come through. So it's very, very difficult to pick one. Mm-hmm. But if I had to, I would say one that comes to mind is the story of Ian Ward, who's an Irish man who was diagnosed with stage 4 brain cancer, terminal brain cancer. Coincidentally, he went in for a different scan and was diagnosed with brain cancer. And we've been working with him, talking to him for a few years now. And his story is really inspirational. I mean, he, even with the knowledge of this, dedicates his time now entirely to raising money for cancer research and cancer awareness. He runs marathons dressed in funny costumes, and it's just very inspiring to see quite a difficult challenge in life turned into a drive for change.
I understand that. Okay, wait, just one of queries I'm curious about. So do you guys actually go to the field, or do you guys visit any country that one of your in your membership list?
Yeah, so so a lot of my colleagues at UICC will travel regularly to visit members in different contexts. However, with World Cancer Day, in order to keep it truly global, unless we were to travel to every single country, we remain in Geneva, focus more on coordinating links between countries, providing materials that they can use, or for example, hosting online events that anyone can join. So this year we'll have something called the Oncothon, which will be a 24-hour live stream that many people can join and talk about. So and that's the kind of thing that we'll do. But then what we also do is follow the events happening around the world. So beforehand, we will, touch base with our members, know what they're doing. Sometimes we're able to, tune in live and join their event from afar and share it with the world. There's a map of activities where people can go and post their events on worldcancerday.org. So even though we can't be there on the ground, as you said, we like to follow as much as we can.
Understand.
Yeah. And then when we talk about people-centered care, we usually think about only a few certain group of people. For example, we often focus on hospitals or the patient itself. But what about the people surrounding the patients? For example, friends, neighbors, or colleagues, and how can this group of people can support to someone that going through this journey or cancer journey?
Yeah, I think that it's something that is talked about a lot as well. The importance of people that support, the close family and the close network that support people living with cancer, and also that they support themselves. Being a caregiver or being a family member is also can also be a difficult duty. So understanding that they support the person living with cancer, but that they also need to support themselves. But in terms of, what they can actively do to help, and maybe in this case, I would feel more comfortable talking about World Cancer Day, because I don't want to give advice on what caregivers should do. I don't think that's necessarily what UIC focuses on. But in terms of World Cancer Day, I would say that there's a lot of education and awareness material. So really understanding cancer, that comes first. And also things like we have a how-to guide, a toolkit on how to talk to people with cancer, because that can also be difficult, knowing what to say and how to say it. So listening to what how people want to be talked to. But then also, if you want to take action on people-centered care, or if you want to, know what you can do more concretely to move ahead this theme, then there are also guides that we provide on, how to fundraise, how to host an event, how to raise awareness. So again, this element of, choosing something and taking action on it. And finally, what I was mentioning before is these stories that people are sharing. We're seeing an increasing number from caregivers who are giving their perspective. And I think in a way that's also helpful, because it allows others to learn from their experience, maybe to find similarities, maybe to find differences. But those are voices that also deserve to be heard. And hopefully through this campaign, we focus on the wider context as well, and encourage everyone to
participate. Understand? Okay, so talking about this World Cancer Day, right? With all these long-term goals and system-level challenges in mind, okay, where do you see World Cancer Day fitting in? Like, what can a single global movement realistically do to help move the needle forward?
Yeah, that's a really good question. I think that we live in a time of mass communication, of some might say infobesity. Every time you open your phone or your laptop, you have so much different information coming at you from all angles. And similarly with, you have awareness days, weeks, months, you have 200 different kinds of cancer, all lobbying for different elements and all very valid. And what World Cancer Day tries to do is really take all of these elements into one, to unite the entire cancer community and to speak with one voice and to cut through that noise. So, just to give a few examples from 2025, from the campaign last year, as I mentioned before, we saw 900 activities in 102 countries, but we also saw 30,000 press mentions, and we saw 9 million global interactions, and we saw influential speakers like, Kylie Minogue or FC Barcelona talk about World Cancer Day. But equally, UN agencies like Dr. Tedros released a video on World Cancer Day to talk about different elements of this global burden. And we saw governments as well pledge change and reiterate support. So, to give an example from the EU, the European Commission had a youth policy dialogue where they invited young people in the cancer control space to share their ideas and share innovative ways of tackling cancer control. So as much as it might seem to not make a big impact when one person posts a story or shares an image, when the entire cancer community and all of their supporters do it, that's when we see real change happen.
So looking at all that campaigns, activities, is there any that taught you something unexpectedly, like, wow, amazing, this kind of activity or this kind of campaign is really not overwhelming, but something positive unexpectedly?
Yeah.
In terms of activities?
Yeah.
I mean, one thing that we did see, and maybe this is slightly going around the question because it's one activity that we actually encourage people to do, is something that we call the Upside Down Challenge. So it's the idea, again, to come back to this idea that people are constantly scrolling on their phones and maybe missing a lot of important content. We wanted to do something a little bit different, which was to encourage people to post about cancer, but to flip their picture or their video upside down. And then start with the sentence, cancer turned my world upside down, as a prompt to share their story. Or it could be from a more general perspective, cancer turns your world upside down, or at MAKNA, we see how cancer turns people's worlds upside down. So to try and play with that to suit your perspective. But we saw a lot of people stopping and saying, oh, what is this? Have they posted this wrong? So it was just a visual trigger to try and get people's attention. And we saw actually last year over 1,000 people doing that, and we'll do that again this year. So we really hope to see even more people doing that in 2026.
That's a good idea. Really good idea.
I encourage you to do it.
We'll ask the communication team.
Okay. Now, looking at the work in Malaysia and what MAKNA did, I just want to ask, how can MAKNA play a bigger role in this overall campaign, and also in helping the campaign to create a kind of a lasting impact towards the cancer community, especially in our country, in your opinion?
Yeah, I mean, I always think of World Cancer Day a little bit as a menu. There's so many different things you can choose from, and there's no right or wrong. It's really any action, big or small, can make a big difference. I think with regards to making an impact on people's sense of care, if you have a wide community, then encouraging them to share their stories on our website, because those stories don't just appear and then disappear. We're going to collect them and analyze them and create a report to see what are some of the key issues that that are recurring. So we have, for example, the option to complete a short question and answer version, and it asks questions like, what was your experience of the healthcare system? What was the biggest challenge you faced? What was the what helped you the most? Or what are your words of advice? What is your message of hope? So really answering these questions, because that's how you get knowledge, and that's how you then can see it. And then if we have a lot of responses from, for example, Malaysia, maybe you start to see what are some of the recurring thoughts and information that comes through from your country or from your region or from a global perspective. So I'm really looking forward to analyzing all of those at the end of the campaign, and to creating a report based on that. Yeah.
Is it why we need to be active in Connect as well?
In Connect?
Yeah. Is Connect also one of the platform to us or all members to get highlighted?
Yeah, you're referring to UICC Connect.
Yeah,
definitely. I mean, UICC Connect is a great platform. It's a kind of space for the cancer community to come together and talk about different themes that interest them the most. However, I would say for the story sharing, the best way to do it is on the World Cancer Day website, on worldcancerday.org, because then you're contributing to this global pool of stories that people are adding. People can read them, whereas UICC Connect at the moment is a bit more of a closed platform.
I see.
I think that the public website is a better option for that. And just also to mention that people from different perspectives are welcome to share their stories. So when you would start, you can choose if you want to speak from the perspective of a person living with cancer, caregiver, healthcare professional, supporter, family, friend. So it's really, and then those questions would be slightly changed based on the perspective that you choose.
I understand. Okay, now I can see the difference between the World Cancer Day web and the UICC Connect. Okay, so when you look at the next decade, right? Okay, this one is a bit of a further question, further from previous question, like what areas of cancer advocacy do you think need more public attention?
Yeah, I mean, cancer is obviously a hugely complicated and complex topic, and one of the greatest global health challenges. So it's difficult to find a few areas to take action. But I'd like to highlight a few from the World Cancer Declaration, which is from 2025 to 2035, and was created with UICC members, with the board of directors, and with UIC partners as well. And the 5 action areas that we have for this 10-year horizon is first on planning and implementation. So making sure that countries have well-defined and funded national cancer control plans that are, include timelines and monitoring. The second point is on a cancer information system. So really gathering cancer data, because that is the basis of decision-making, of research, understanding trends and outcomes. The third point is on research and innovation. So making sure people invest in cancer to improve prevention, early detection, and treatment. Mm-hmm. The fourth action point is on education and training. So making sure that countries have, strengthen and sustain a skilled workforce. And finally, as we've been talking about this entire podcast, on people-centered care. That is one of the 5 key points.
Key elements, yeah.
Okay. I think we're almost the end now.
Yeah.
Okay, so yeah, one of the key outcomes was on people-centered care, which is what the campaign is now about for the next 3 years.
Yeah, and what is actually people-centered care? Actually, yeah.
So people-centered care is the idea that the needs, values, and active participation people living with cancer, so individuals, but also family members and the wider cancer community are integrated in the planning, delivery, and implementation of care. So the cancer is rising, and in 2022 alone, 20 million people were diagnosed with cancer, and for many this becomes a complex and long-term disease that impacts many aspects of life, from job prospects to family relationships, to mental health, physical health, sexuality. So understanding these differences is incredibly important for care, and it impacts not only the individual but also their family and their wider community. So the individual circumstance every person comes from, their income, their gender, their race, their ethnicity, all of these things can really impact how they seek care, how they access care, and how they respond to treatment. So we need services that are adapted, appropriate, and accessible to the individuals and the communities that use them. And that's where the idea of people-centered care comes in.
Actually, the concept of this people-centered care really resonate MAKNA services. For example, like we provide financial assistance to our patients, to the cancer patient, but the reason why we give the financial assistance, not for them to buy groceries or to buy medical
or daily living, used for daily living, but
actually the reason why we give them the financial assistance is as a transportation fee. Like for example, the hospital is quite far from their house, so these underprivileged cancer patient, they have no money just to go to hospital, not even to go hospital, to eat on the daily basis also quite difficult, right? But that's why we provide financial assistance for them to go to get the treatment based on the transportation fee.
Yeah, that's a perfect example.
Yeah.
And also actually we have in MAKNA, we have cancer screening unit. So basically we have trailer with mammogram services. So we provide for free underprivileged, and also at the rural area. So that people can get early detection.
So there's a few examples of what actually MAKNA did. Not only to close the gap, it's also to unite it by unique as well.
Yes.
Those are excellent examples, really.
Yeah. So
to wrap things up, I believe. So do you have a hope for the future cancer care? Or is there any final personal message from you to audience?
Yeah, I mean, I would just, in terms of hope, I would say yes. Every 4 February, the atmosphere in UICC is busy, I have to say, but also extremely joyful and hopeful, because it's pretty amazing to see these different people around the world coming together on this one day to, call for change, but also celebrate progress and show the strength of this community. So I really encourage everyone to get involved in World Cancer Day. It's open to all, and we really welcome any action, big or small.
Cool. All right. Okay. Thank you, Alessandra. And to audience, don't forget to like, share, and subscribe our Konti Cancer. Ciao.
Bye-bye.